Good afternoon, and welcome to Spelman's live web chat, Advancing the Health of Black Women. Today we're going to discuss some of the health disparities plaguing Black women and solutions for improving the health and wellness of more than 19.5 million Black women and girls living in the United States. I'm Ivory, a Spelman College graduate from the class of 1991, and I'm the co-host of the morning show on the Ryan Cameron Morning Show on the People Station V103 right here in Atlanta. I'll be moderating the chat today between our president of Spelman College, Dr. Beverly Tatum, and Dr. Valerie Montgomery Rice, who is the Dean and Vice President of the Morehouse School of Medicine. Welcome.
Thank you.
Before we begin our chat, I want to invite everybody to tweet your questions to Dr. Tatum and to Dr. Rice using the hashtag #Spelman Wellness. And we'll get some of those questions answered at the end of the session. Let's dive right into this important conversation. A recent headline in the Atlantic magazine read, "U.S. women are dying younger than their mothers, and no one knows why." As this headline suggests, the health status of women, more specifically Black women, is in a critical state. Whether it's diabetes, high blood pressure, heart disease, or breast cancer, Black women are more likely to suffer from these diseases and die earlier. Dr. Rice, from your perspective as a medical doctor, what are some of the reasons why we see these health trends among Black women?
Well, you know, what we have experienced over the last 5 to 10 years is a significant increase in obesity. And part of the challenge for us as African American women is that when we see these increase in our obesity status, do we have the resources to change our trajectory? And what we found is that there are lots of social determinants that really influence our ability to have access to good nutritional food, to be able to exercise, to be able to focus on ourselves, because many times we are the primary breadwinners. But saying all of that, what we have to do is create more opportunity for women to engage in activities that allow them to focus on themselves. And I know that if we were to be able to reduce the amount of obesity, which serves as what we call a confounder for all of those diseases. So no matter what disease you look at in this country, what we know is that if you are overweight, then we know that it's going to compound the complexity of the disease and create more complications. So I really do believe the root of what we're seeing now is the significant increase in obesity that we've seen, particularly among African American women.
And at a younger age.
And at a younger age.
Today marks the start of National Diabetes Month, and it has been reported that more than 40% of Black women older than 20 already have hypertension, and a large number also have diabetes and other chronic illnesses. Dr. Tatum, a year ago today, Spelman made an important decision. Everybody was shocked about the decision to go away from the NCAA programs at Spelman and instead to begin a new wellness initiative for students and to create a revolution known as the Wellness Revolution here at Spelman College. As it relates to health and wellness, what were you seeing among the student body, among the faculty that made you make this decision?
Well, we were seeing that, in fact, just what Dr. Rice talked about, certainly a rise in the number of students who were arriving here as first-year students already suffering from chronic diseases. Certainly many obese or overweight, but much higher rates of hypertension and type 2 diabetes than you would expect among a population of that age. We were concerned too, not just about our entering students, and in the class of 2016, nearly half of them were already coming to us with chronic illness or conditions such as obesity, hypertension, type 2 diabetes. But also, I was aware of the fact that our graduates were dying at an early age. We have wonderful reunion experiences. They come back every 5 years. And when the 10-year reunion class comes back, you're looking at women who are in their early 30s, and still we're lighting candles for women who've passed away since they graduated. It seemed to me that we had an opportunity here at Spelman to really engage our students in lifelong habits that would improve their health trajectory, and using the influence that Spelman women have, influence the wider community. And one of the things we knew we could influence, at least we hoped we could, was to increase mobility, more movement. When Dr. Rice talks about all the things that cause women to die early, we also know that 30 minutes a day of regular exercise can reduce the likelihood of getting diabetes or breast cancer or any number, even Alzheimer's as we get older. So the fact that our students tend to come to us as sedentary and that we can change that pattern is really what we were thinking about.
Oh, wonderful.
You know, I think about when a young woman comes to college, we equip them with skills. One of them we equip them with is study habits. So they learn how to study. They learn how to set goals. They learn how to monitor milestones for a desired outcome. Our health ought to be the same thing. And so this learning environment that Dr. Tatum is referring to is an opportunity for us to create these wonderful habits. They're just better nutritional habits. They're exercise habits that go hand in hand with study habits, because that's going to be a much more effective student if they are healthier. And so I think it really makes sense for us to integrate health and wellness into the platform of our educational curriculum.
Absolutely. Thank you, Dr. Tatum. Thank you, Dr. Rice. Before we continue our discussion, I do want to remind you to tweet your questions to Dr. Tatum or to Dr. Rice using the hashtag #Spelman Wellness, and then we'll get to those questions at the end of the session. Now back to our conversation. As we look at statistics from the Centers for Disease Control and the National Institute of Health regarding obesity, depression, hypertension, and a host of other diseases, the reports for Black women are alarming, to say the least. We know the lack of health care has significantly contributed to health disparities among Black women. What implications do you see the Affordable Care Act, once it's all up and running, have on the health status of Black women? Dr. Tatum, let's start with you.
Well, certainly one of the things that we see here is that the Affordable Health Care Act allows students to remain on their parents' health insurance much longer. So the student who's graduating at 21, maybe doesn't have a job yet or is going on to graduate school, can continue to maintain her health, get checkups, have mammograms, et cetera, because she can be covered until she's 26. That is, of course, tremendously important to our students. But I'm sure that Dr. Rice, in her role at Morehouse School of Medicine, can even elaborate on that.
And, you know, one of the things that I think is really important that people also didn't understand the impact of that. So let's say a young lady gets out of high school and she comes to college with one of those pre-existing conditions. Previously, if she was without health insurance for about 6 months or so, then she would have problems ever getting insured again in an expeditious time frame. Now, because of that, we see that those students are not going to have that challenge. So again, an opportunity to start her continuation of interventions that may lead to better health. The other thing, though, is that the Affordable Care Act was really important for women in the fact that now all of those preventive measures, annual mammograms, okay, pap smears, colonoscopies every 5 to 10 years, depending on your risk factor, going to get contraception, all of those things could now be achieved without having to have that significant copay, which really does make a difference for women, particularly young ladies in college. And so I'm really excited about what the Affordable Care Act has done, regardless of what is happening with the website, okay? Technology fails us sometimes, but that does not mean that the ingredients of this Affordable Care Act are not important. And we've begun to see the benefit of it almost over a year now, because we are seeing more women come in and get their mammograms, more women having their pap smears. And you know, the new age for first-time screening for a pap smear is now 21. Okay, many people don't know that, but that doesn't mean you shouldn't go to your doctor. You still should go start. We said that women should start seeing their first time visit with a GYN should be somewhere between the age of 15 and 17 to start having conversations to build that comfort level. But you don't need your first pap smear, cervical screening, until the age of 21. But one of the things that you might want to get is HPV vaccination, the human papillomas vaccine, because we know that most cervical cancers are a result of 2 of the genotypes that can be prevented in that HPV vaccine. And you can receive that as early as age 13. I actually don't think that any woman should come to college without having the consideration of the conversation of whether or not she should have had the HPV vaccination.
And is that HPV vaccination available under the Affordable Care Act as
It
one
is,
of the
it is,
wellness?
it is available. It
That's
is available.
wonderful. That's wonderful. Thank you so much for those questions, those answers that are very important. Do you also think, one quick question, do you also think that the extension of the age to be able to be covered under your parents to 26 would also allow students a little bit more freedom to think about going to graduate school after college in order that, not have to rush right to work because they need health insurance?
I absolutely think that the more resources like that kind of insurance availability does help students make better decisions, or decisions that are right for them without having to be influenced by whether or not they can access insurance.
Sure, by financial burdens. Thank you
Yes.
so much. Once again, I want to remind you to tweet your questions to Dr. Tatum and to Dr. Rice using the hashtag #Spelman Wellness, and we will get to your questions at the end of the session. Dr. Rice, let's talk about solutions. What do you, what do we do as a community to improve the overall health of Black women?
Well, first of all, we have to recognize that we have some differences. We have to embrace who we are, understand what our challenges are, and then set out a plan to do something about it. So we know that we have the highest rate of obesity. Dr. Tatum, in her wisdom and the institution wisdom, understood that more of their students were coming to school at a disadvantage because of some chronic diseases. So they are creating programs that get kids doing some simple things, moving 30 minutes a day, programs that talk about nutrition, changing what's available in the cafeteria so that people have the option for better choices, and then programming. Programming, one of the things that I would tell you, and my daughter would probably laugh, but I started doing CrossFit. Now, I'm not an aggressive CrossFit person by any stretch of your imagination, but I can do anything for 25 or 30 minutes. It fits into my lifestyle. Okay, and that's what I think we have to do, is meet people where they are. And a lot of times we don't do that. When we look beyond the college age and we look broader in our community, we still continue to have food deserts, where people do not, within a 3 to 5 mile radius, have the opportunity to actually adhere to a diet that would prevent them from ever developing diabetes. They don't have safe walking paths. People still continue to have challenges with water in some communities. So those things are public policy issues that must continue to be addressed so that we can see the community benefit from the fact that they now get to go to the doctor. And we want them to go to the doctor before the disease occurs, because we know that it's the highest chance of prevention.
Wonderful. And your thoughts, Dr. Tatum?
Well, I just want to underscore what has already been said by Dr. Rice, particularly in the context of Spelman. We are very interested in focusing on eating better, moving more, sleeping well. And the moving more part of our initiative really speaks to the fact that even regardless of your size, your physical size, and I think Dr. Rice will confirm this, regardless of your physical size, you will be a healthier person if you're physically active. So I define success here at Spelman by creating a culture of movement. When we had our first 5K last April, April 2013, it was very exciting to see 700 people, many of them students, out ready to do that walk or run, some of them for the first time ever doing something like that.
That's wonderful.
And getting ready to do it again, participating in the AIDS Walk here in Atlanta. Those kinds of activities are part of creating a climate where people expect to move, to get off the couch, from the couch to the 5K, we like to say. So let's keep moving, and along the way, you might lose some weight. Certainly, I know for me, in order to maintain my weight, I have to exercise. I travel a lot, and that throws you off your schedule, but there are sneakers in my suitcase all the time.
That's wonderful.
So that when I get where I'm going, I can use the gym at the hotel if I need to.
Sure. Spelman movement. We like the way that sounds for
Yes.
sure. Thank you so much. And I want to remind you once again that if you have any questions for Dr. Tatum or for Dr. Rice, just use hashtag Spelman Wellness and we'll get those questions answered. Since the launch of the Wellness Revolution at Spelman, I know that there's been a host of activities that you mentioned, like the 5K, which help women, move and eat better and sleep better. What are some of the initiatives taking place currently at Spelman that will continue this movement and these initiatives at Spelman for students?
Well, we're very excited by some of the changes that are taking place already. Our physical education staff are already revamping our physical education offerings to focus more on movement. Of course, we want people to learn how to play different sports, play tennis, learn golf, but we also want to do that in a way that keeps everybody moving, not just standing around watching, waiting a turn, but keeping everybody moving. So that's exciting, the innovation that's coming out of our physical education and wellness programs. We, of course, have not only the PE courses, but we also have the opportunity for students to participate in classes like Zumba, yoga, Pilates, throughout the day. The Reed Hall is open longer hours, more opportunity for physical activity. But we also are getting ready to make a change in the building. When Reed Hall was built in the 1950s, we only had 500 students. Today we have 2,100 students, and we know we need a different kind of space to accommodate that. I'm very pleased to say that our plans are in place, and we will begin our construction project in just a few months, in the spring of 2014. So in the spring of 2015, we will have a facility that is really designed to support the vision that we have for our Wellness Revolution, including a demonstration kitchen, so we can focus on nutrition.
It's very
Wonderful.
important, very important.
I'm really excited by that. But of course, we have made some changes in the dining hall, as Dr. Rice suggested we should, and there are, as I like to say, you can still do damage there if you don't moderate, but we have healthy choices every day in and out, lots of ways that you can change your own habits to improve your health.
Well, I sure am familiar with Reed Hall because I did get that freshman 15 when I ate there all the time. But what has been so alarming is that freshman 15 has turned into the freshman 50. And so there's definitely the necessity to make things to do better. And I've seen the changes even from when I was here. So I'm looking forward to seeing even the bigger changes, as I have a daughter that I'm crossing my fingers will be in the class of fall 2016 coming in. So everybody pray out there.
I also want to mention that we are wanting to document very carefully what we're doing. So we have a group of faculty working with our health service team, and we have now a visiting scholar who has joined us to help us, and that's our own Spelman alumna, Dr. Fleta Jackson, who is helping us document from a data collection point of view the things that we're doing and the impact that it's having on our community, because we want to be able to tell other people, other colleges, other universities, what we are doing and to be able to spread the word.
Sure.
We've also recently partnered with NICHD, which stands for the National Institute for Child and Human Development, and we will be partnering with them to offer a National Wellness Summit in February. So we look forward to telling you more about that as we get closer to that date.
Well, it's a very proud thing to be the first to do something like this, and I'm sure Spelman will be, consulted to do this for other colleges that will have to be forced to do a wellness revolution.
Well, I think that the documentation, and as a researcher, I definitely always want to see an evidence-based approach, and I really applaud the fact that they put the resources in place to document the interventions, because every intervention won't work for every woman.
Sure.
And so we really do have to have a plethora of opportunities for women. And it's some of it's movement, some of it's making better choices, some of it's decreasing the stress that surrounds people being more stress eaters. And all of those things collectively is what is going to move the needle. And it's not going to be a needle that moves real fast. Okay, you'll see some people who will drop weight and all of that, but what you're talking about is how do we create a culture where people expect that when they come to Spelman, we don't expect to gain 15 pounds. That becomes not what we expect anymore. What we expect to do is to stay healthy and active, because we have provided the resources and the options for women to do so.
Sure. Dr. Rice, as a medical doctor, what is one thing you can think that a woman could walk away from this conversation today and start doing immediately that would be a benefit for her health?
If I had to tell women to do one thing, it would be to exercise. If it's nothing but walking 30 minutes a day, it is something that will start to really change your life. It increases your cardiovascular capacity. You definitely have more energy. It stretches your muscles. You feel better. And then set goals for yourself to the point that you get up to somewhere around 3 to 5 miles, okay? On the weekends, weekdays, sometimes it's harder, but you could get to a point where you're walking at least an hour a day. That may be 30 minutes in the morning, 30 minutes in the afternoon. And get a partner. Get a partner to do it with so that you all can motivate each other and really, keep pushing each other to move forward. I also always encourage women not to use the scale as their friend, particularly African American women, because we have more muscle mass and we tend to weigh more based on our size as we compare to other women. And so what I use is a tape measure. Everybody knows I always say it's not your weight, it's your waist. And so I always say to people, look, get a tape measure, get your baseline measurements around your bust, around your abdomen, 2 finger breadths from your navel. Your navel is not the place to measure because that's the smallest part. Your hips, your thighs. And then you will be amazed as you start to exercise how you will start to change and you will start to see the decrease in the inches. We now know we can correlate that with your risk for cardiovascular disease because as you start to exercise more, you're going to build muscle mass and that's going to weigh more. So that may discourage you if you use the scale as your only measure for how successful you're being.
That's great. I know a lot of women, myself included, use the scale as success, and it's nice to know you can move away from that and think of it in other aspects. Dr. Tatum, what does the successful wellness revolution look like at the end of the day at Spelman?
To me, the success of the wellness revolution, we'll know we've been successful when we have what I call a culture of movement at Spelman, where people are out, moving, walking at lunchtime, engaging in the opportunities that we make available on a consistent basis, and when they're doing that, improving their health in all the ways that Dr. Rice suggested. But also when it's not just Spelman women, but when those Spelman women take what they've learned and go out into the world and spread those ideas to our alumni community, to our neighbors, our children, church communities. Think of all the places where women have influence. I often say we call it a wellness revolution in part because the revolution that Spelman was itself in 1881. When we think about the founders of Spelman and they came to Atlanta with the idea of creating a school for women who had just recently escaped or been liberated from slavery, and they had a vision that if you educate these women, teach them to read, help them learn how to study the Bible, they will spread that word to other people. And if you think about how quickly literacy spread among African Americans at the turn of the 20th century, it was quite rapid, and largely because those who had been educated educated others. In the same way, we can see that those who learn the tools of wellness literacy can spread that information, and when we see the decline in those statistics that you cited at the beginning, then we'll know we've been successful.
The other thing I want to add is that remember, the skills that these women will learn during this time, they're going to be able to pass on to their children.
Yes.
And that's the most exciting part of it for me because we know that there are lots of influences that impact the development of obesity and diabetes and cardiovascular disease. But it starts very early on. And so if these women are empowered with habits, they're going to transfer that to their children who are going to be empowered then to live their life differently than perhaps we have lived our lives. And I think that's the most exciting part of this revolution.
That's wonderful.
If I could just add to that,
Please.
too, as you were talking about passing on to your children, I was thinking about our partnership with NICHD, and one of the things that they're excited about is healthier mothers, right? I mean, not only will these young women be able to teach their children in a different way, they will likely have healthier children.
That's right.
Because these are women of childbearing age, and if they increase their activity and improve their diet and all of that, it has an impact on the children they will deliver in the future.
And their pregnancies will have better outcomes,
Yes,
just in general.
exactly.
Because we know women who are obese when they become pregnant They still gain weight, of course, and we want everybody to gain some weight when they're pregnant, but we know that it is fraught with more complications. And so we are very excited to see that this is not just going to impact this woman at this point in her life, but it is a continuum. And that's what education should actually be about.
Yes.
How does it change the outcome?
Yes, that's wonderful. Thank you, Dr. Rice, and thank you, Dr. Tatum, for those great words. We're going to go to some audience questions now because I know that we have a bunch of questions from Twitter. So at Only One, Sherilyn from Twitter asks, how will the new Reed Hall facility change the wellness culture at Spelman? And you mentioned one about the demonstration kitchen. Is there any other way?
Sure. Well, if you were in Reed Hall today, one of the things that you would know or notice is that the room that has the cardio equipment is very small. It's difficult for more than just a few people to use it at any one time. The area for weight training, strength training for women, small area. The pool in the building now, it's a nice enough pool, but the new building will have a larger pool, more space, much expanded space for cardiovascular activity, whether that's treadmills or elliptical machines or other kinds of equipment like that. A lot more space for free weights, and then space for all kinds of classes like Zumba, like yoga, like Pilates. Some small spaces, some larger spaces, rooms with mirrors and that you might want to do dance classes in, rooms for our large gym that we have now, but it'll be a little bigger and accommodate intramural activities. So for the student who still wants to play volleyball or basketball on an intramural basis with her friends, we'll still have that opportunity. The new thing that you have alluded to and that I've referenced that the building does not have now is certainly this demonstration kitchen. And we think that that combination classroom kitchen will be a great opportunity for students to learn about all kinds of nutritional information and how to live, you know, healthy diets on a budget. There are lots of different ways, and we hope to open those sessions to the wider community so that we are a resource not just for our students, but for the surrounding neighborhood as well.
That is wonderful. I think I'm going to come over and take a few classes in the demonstration kitchen. Nicole Moore King from Brooklyn asked, what steps should people who live in food deserts take to eat healthier? And you mentioned, Dr. Rice, food deserts earlier.
Yes,
so what should somebody who finds themselves living in a food desert do to have access to healthier food?
Well, one thing they have to do, and this is an advocacy issue, they really need to talk to their legislators in their area to talk about what is the reasonable amount of distance one should have to travel in order to have access to food. And then they need to go to those small markets. And there have been many cities that have taken this on. And there are actually some projects going on, I know right now, with the Blake Foundation, the Arthur Blank Foundation, that is really trying to work with how do we go to these mini marts and those places and talk to them about what are they offering in there. Can we incentivize them to offer fresh fruits and vegetables? Okay, can we incentivize them to reposition where they have some of the high caloric items? Can we talk to them about where they position tobacco and those type of things, such that the first option that a person sees when they come into the mini mart is actually a good choice. Okay, and that's hard to do. And so it really becomes a community action initiative. The community really has to work collectively to say, we want to do better and we deserve to have better. And then it is about partnerships and collaborations with state legislative, local legislative bodies to talk about, can we rezone areas so that we can put grocery stores here? Can those grocers, large chains, get the incentives, the tax breaks that will really make a difference to them coming to this zip code versus another zip code? That really becomes an advocacy issue. Now, let's say that all takes time, and I want to go on a diet right now. I talked about partnership. So is there someone that you can partner with who you can make a commitment that we're going to go shopping to some wholesale type places? And then I've seen people do this all the time. They buy in bulk, and they split it up amongst families. We buy in bulk and we split it up amongst families so that the food is there and it's healthier. And then the third thing that I would say is community gardens.
Yes.
Community gardens, and you know, that's something that I think that we ought to be doing here in the AU Center. We got some land that I think that our students would embrace the opportunity to create some community gardens. It could be an exercise that brings in resources for the institution, but the most important thing, it could be a resource for bringing the community together.
Oh, I love that. Brittany Couch asks, considering all of the new renovations, what dietary and food option choices will take effect to help reshape the culture of the student body toward holistic wellness? Are you working with anybody to completely change the menu at Spelman, or have you already done that?
We have been working on it, absolutely. So we, in our dining hall, have been working with the Aramark food vendor, that's our vendor here at Spelman, to implement healthy choices. If you enter the dining hall today, one of the things you will see is a flat screen that tells you what's being offered and what the caloric content is. So you know what you're getting when you get it in terms of how many calories you're taking in. We've seen changes in terms of a larger selection on the salad bar, for example. More options in terms of salad dressings that go on that salad. We all know that you can make a wonderfully healthy salad and then kill it with too much dressing. So these are some of the things that we are looking at. I'm a vegetarian, I will say. I've been a vegetarian a long time. I'm pleased to say that the vegetarian and vegan options that are available in the cafeteria have certainly improved. You now can go and choose your own vegetables and bring them to someone who will stir fry them for you and put a meal together in ways that can be very healthful and certainly low calorie content if you choose wisely. So these are the things that we've been working on, and while, as I said, you know, there's still plenty of ways to overdo if you want to. If you are wanting to, and I should just say this, the plates are smaller.
That
so,
helps.
you know,
Yeah,
everybody, it's, sometimes we don't know what a serving really is. We think we're having one serving and really it's three. But one of the things that the vendor did this summer was to renovate the space and also provide more appropriate portion-sized plates.
That's wonderful. We have a question about mental health.
Yes.
As it relates to wellness,
Yes.
and that so many women, you know, whether it's students, faculty, or, you know, just the greater community dealing with mental health issues that of course affects your wellness. I mean, how do we begin to deal with those mental health issues? So all the things that come with, you know, an unstable mental capacity can help with our bodies.
Can I say something about that? I know that Dr. Rice will want to chime in, but I am a clinical psychologist by training. And one of the things that I think people don't always recognize is the impact of exercise on physical and mental health. I do know that if someone is depressed, they don't feel like moving. But as someone who's worked with clients who have suffered from depression, one of the first things you try to do is get somebody to move, to engage in physical activity, because the chemical results in terms of the brain and the way it operates actually begins to lift mood. It is one of, in some ways, even better than antidepressants. Now, I don't want to sound overly simplistic to say if you're depressed, all you have to do is exercise, you'll feel better. But I think it's important to recognize that engaging in regular physical activity reduces stress and reduces the incidence of depression. We, of course, have a counseling center here at Spelman, and anybody who is here as a student who is suffering from concerns about mental health should avail herself of those resources. But certainly we see health and wellness as very much including mental health as a component.
And my only comment would be is that some of the most challenges I see for young women who really do have a diagnosis of depression is some of the medications that they're taking really do cause weight gain. And so we're in concert with their provider to look at other options that, because a lot of times they're exercising, they're doing the right things, but the medication itself causes them to slow their metabolism and decrease their probability of losing weight, but more so gaining weight, and see if there are other options. Now, I'm not saying stop your medication, I'm saying clearly to do that in concert with your provider, but we have now an array of opportunities and other drugs that women can utilize in order to fight depression. And then the other thing that I recognize is that it sort of gets to be a vicious circle. You know, I gain weight, I start to feel bad, I eat because I feel bad, and then it's a vicious circle. And so at some point, how do you break that vicious circle from occurring? And what I am, again, that's why I keep stressing partners.
Yes, social
having
support.
someone who
Accountability.
supports you and holds you accountable.
Sure.
But then also recognizes how hard this is. None
Yes.
of this is easy. And the exciting thing that I see happening here is that this is going to be a group effort.
Yes.
That everybody, you ought to be able to find somebody in your dorm or somebody on your floor, or probably one of your roommates, who's going to be engaging as a partner with you to make it through this. And you can lean on that person, and that person can lean on you.
That is wonderful.
Social support is really critical, and I think that the partner concept is such an important one.
Yeah.
What would you, as we begin to wrap up, what would you want to say to parents? Parents who have a child maybe getting ready to go to college and they're preparing them for leaving the house and having to make all these decisions on their own. Or parents who have a student at Spelman right now and who's struggling with their weight and all the things that come with being overweight. What do you want to tell them about how they can be a partner with their child, what they can do for their child?
Well, I think that to the extent that it is a family effort, it's a wonderful way to support each other. Sometimes what I hear from students is that, I'm working on these things, I'm trying to make healthier choices, but when I go home, my family wants me to eat like I always ate, and, and sometimes they don't understand why I'm making these changes. And I remember when I was in college when I decided to become a vegetarian. And I remember going home that first time and my mother thought, what do you mean you're not having turkey at Thanksgiving? It was like, I've made this for you and this is how I show love. And sometimes families are not as supportive of the healthy choices their young people are trying to make. But when it's a family effort, it can be a great strategy to work together. The family that eats well together stays healthy together. And to the extent that the student can help lead the way, as it turned out in my family, over time, my family's habits didn't become exactly like mine, but certainly became healthier over time as a result of the influence I had as a student trying to make some new choices.
And I am fortunate to have a daughter here at Spelman who's a sophomore, and I've been very, very pleased to see that the habits that she had for exercising have continued, and she influences me. I mean, really she exercises pretty regularly, and our family exercise, and it has really become something that holds us together. So when we go on vacation, when we were last on vacation this summer, we were all up exercising. My son just went off to college, and we were all up exercising together. And so it really does, again, provide an activity for you to do together. And so what you also, though, have to be sensitive to meeting people where they are. So everybody is not going to do CrossFit. Everybody's not going to, I can't stand to run, but I like to walk. My daughter runs, and she runs a couple of times ahead of me while I'm walking to keep up with her. But it's still something that we try to do together. And so one of the things that I would say as a parent is to a parent who has someone here in school is to say, you know what, positively influence them, meet them where they are, encourage them to have the habits, encourage them to capitalize on all the opportunities that Spelman's going to offer them.
That is wonderful. We can go on with one more question. How will, well, I think we answered that. How about sleep?
Oh,
you
yes,
mentioned
let's talk about sleep.
good sleep, and everybody struggles with that, right? I'm sure both of you have the kind of schedules you have. I have a schedule that's crazy, and it is hard to get good sleep. Is it really that important for wellness and weight to have the adequate amount of sleep that you need?
Well, I know that Dr. Rice is going to give us the medical answer, but let me just say, I thought I was a pretty well-informed person, but I did not know until relatively recently that if you don't get enough sleep, it can cause you to gain weight.
That's right.
That, in fact, the body needs time to repair, and if you don't give it enough time, it creates stress hormones, and those stress hormones contribute to weight gain. And so even if you're doing everything else right, you can find yourself gaining weight simply because you're not getting the proper amount of sleep.
Right. And I don't need to say it any more technically than that. It is the truth. 7 to 8 hours of sleep a night. And again, these are these habits that really you have to start early on. So people who have a set bedtime for their children, it makes a difference. Whether you just put them in the room at 8 or 9 o'clock and say you going to bed, it makes a difference because eventually they'll fall off to sleep and they may end up getting 7 or 8 hours sleep. First of all, they function much better in school. Now, I haven't seen where these kids are missing too much sleep because they do take naps during the day. I still see that in college. Right. But it is really important, and the data really does support that 7 to 8 hours of sleep per night will help you to, first of all, have more energy to exercise, but it does decrease your hormonal changes or the stimulants that would prevent you from being able to lose weight and keep you from gaining weight. Yes.
Wow. I never knew that either. I'm glad you told me that about the 7 to 8 hours, that you could actually not even really be eating a donut and going to bed, but you could just be not getting enough sleep and still gaining weight because of it.
Because there's a lot of stress associated with that too, for not sleeping.
Sure. And how about water?
Water,
you know, we haven't talked about water, which is so important because those are two basic things, right? Enough sleep, enough water. So is there some, I know the First Lady has a water initiative for people to drink more water. What do you think about how does a student fit water into their day?
Well, drinking more water is one of the best ways to cut calories, I have to say. If you are a consumer of fruit juice or sodas, you know, sugary sodas, you're adding a lot of calories to your diet that you can easily eliminate by simply substituting water. Water, of course, is the source of all life, and therefore we, you know, need a lot of it. And I heard our Brenda Dalton, who is the Director of Health Services here, talking about just what it means to not have enough water in your system. It means your cells are being constantly bathed in toxins that are not being flushed out of your system. When you imagine that, you think, let me have a glass right now.
Right.
So all of those things that, those derivatives that really will impact your ability to not be able to lose weight are going to be seen in greater amounts. But the most important thing that water does, it prevents you from drinking and eating all of the other things. It really does. It really does. It fills you up. Sure. And so, and I mean, you know, you also go to the bathroom more, and therefore you're able to release those toxins. So all of those things make a difference when you're trying to balance and have a healthy lifestyle.
Great. And so with that, Dr. Rice, would you just offer some closing remarks to everyone who's joining us on this live web chat today to just end the conversation in a great positive note about Spelman Wellness?
Well, you know what I always think about is what's possible. We hear a lot of statistics about health disparities and the obesity that women are experiencing. And I think about how do we move beyond this conversation of negativity to what's possible. And what's possible is what's always been about here at Spelman. What's possible is that we can bring in these women and make them change agents. And this wellness revolution is a part of that change agency that Spelman is known for. So they're going to not only be equipped with a wonderful skill set for learning, but now we're going to integrate health and wellness as a part of that curriculum. So when they leave here, as Dr. Tatum has said, then they're going to influence a greater population of people, not just by speaking with them, but by showing by example of how to lead a healthy lifestyle.
That's wonderful, Dr. Rice. And Dr. Tatum, you had this fabulous institution. What are your closing remarks about, you know, the work that you've done to bring a wellness revolution at Spelman and to keep it going for years to come?
Well, all I really want to say is eat better, move more, sleep well. Join the wellness revolution.
Oh, that's so great. And on that note, we're going to have to end our chat today, but the conversation does not end here. As you've heard during the chat, both Dr. Rice and Dr. Tatum are passionate about changing the health trajectory of Black women. To find out more about what they're doing and their respective institutions, visit them on the web at msm.edu and spelman.edu. You can also find them on Twitter. Dr. Tatum is at BDT Spelman. You can connect with Dr. Rice on the Morehouse School of Medicine's Twitter feed, which is MSM at MSMEDU. You can find me on the web on v103.com, and my Twitter is at Ivory. Thank you so much for joining us today for this live web chat, and I hope it was informative, and stay well.